Our next presentation is about the Volunteer Interpreter Service of the state of Texas, and our presenters are Greg Saxton, the Regional Director, Client Self-Support Services of the Texas Department of Human Services, and Sonia Meinert, Volunteer Interpreter Service Coordinator for the Texas Department of Human Services. Welcome.
Moja dojka bolna. Mi niña está enferma. Translated, this means, from Russian and Spanish, this means my daughter is sick. These are the voices of our clients at Texas Department of Human Services, where I'm the Volunteer Interpreter Service Coordinator. 2 years ago, we were faced daily with communication barriers as we tried to administer food stamps, Medicaid, and aid to dependent children. There are more than 90 different languages spoken in the Dallas area. An estimated 16,000 people living in North Texas who don't speak English are eligible to receive these services. The Volunteer Interpreter Service helps us to communicate better with these clients, regardless of the language that they speak. Here's how it works. When a client comes into one of our offices and needs to apply for assistance, a staff member looks at their computer, finds the automated directory, finds a volunteer who speaks the language of the client, calls the volunteer, connects all three parties by speakerphone, and begins the eligibility process. An accurate exchange of information is essential to determine the correct amount of benefits. This program allows us to communicate better with our clients. Now, the volunteers also are receiving benefits. 27% of the volunteers are also clients. They're gaining work experience right from home without worrying about childcare or transportation costs. They're increasing their self-esteem, and they're helping members of their own cultural group. Now, the volunteer program as a whole is enhancing our agency's ties to the community, are helping us to recruit more bilingual staff, and making efficient use of taxpayers' money. All these things are helping to provide better service to our clients.
Sonia was a caseworker in Dallas facing the language barrier on a daily basis. She proposed the Volunteer Interpreter Service Program as a way to solve this problem. As director in the North Texas region, I approved her proposal and ensured that she got the support necessary to implement this program. We do have bilingual staff. However, many times they're already interpreting for someone, they're performing other job tasks, or they don't speak the language of the client. Using volunteers conserves staff resources, and it means that staff in 19 counties have easy access to interpreters speaking 33 of our most commonly heard languages and dialects. This program is innovative in the fact that it uses existing resources. It utilizes our existing computer network, allowing our staff in all our offices that having computers to access the volunteer list. It connects the volunteer, the worker, and the client using existing telecommunication systems. We have already received inquiries from Child Protective Services and other state agencies interested in replicating this process. We believe this can be easily done. However, success requires a lot of preparation and continued commitment. Some of the essentials to successful replication include recruitment, training and supervision of volunteers, training of staff, maintenance of the automated directory of volunteers, and a telecommunication to link the volunteer to the worker. Communicating our needs, no matter what language we speak, is crucial to daily life. We believe this program allows the agency to use existing resources in the community to provide each and every person that comes to us the assistance that they need. Thank you.
Thank you very much. Jack Rosenthal.
It seems intuitive that having interpreters would accomplish one of the main purposes of saving errors, penalties, public money. But apart from intuition, is it possible to show that?
We're still at the intuitive level ourselves. It's kind of too early to tell. We haven't devised a way to isolate this as a factor. We do know that in reviewing an analysis of case validity data through the quality control process, that the single most important factor is whether the caseworker had communicated well with the client, got the information that was already there and available to them, and acted on it. If you can't speak the language, we know that that's going to make it significantly more difficult to get accurate information.
But various federal programs, food stamps and other, do have ways to calculate error rates.
Oh yes, we just haven't as yet, since we've just been doing this for the last couple of years, figured out a way to isolate that it's the interpreter that makes what percentage difference in accuracy we have using with the fact that there's an interpreter versus other factors that are available.
Barbara?
I want to talk budget with you just a minute.
Okay.
Texas is a very large state. I'll say it so you won't have to say it. I know that your budgets have very large numbers on them, but this budget is a very small budget, which may mean great efficiency, which is wonderful, and cost savings and error savings as well in dealing with patients. But I was concerned about a program that had this kind of potential, and part of its inability to complete its work was that you had interpreters who did not have speakerphones. I read that in one of the evaluations that there were people who did not have speakerphones, so they couldn't always do the service and they weren't always available to them. And my question is, if there's a commitment to the program, it would seem a small investment to be sure that everybody who was trained to do this work and served your clients have a speakerphone. And can you tell me why the investment is so small in the program if it had such great rewards?
Well, I don't think what you said, before we started the program, we had offices that didn't have that capability. And all we spent was $10,000 to upgrade all our phone systems so that we could designate stations that would have speakerphone capability. It required the worker to use that particular station, but they could provide the same service and use a speakerphone.
But aren't some of your interpreters at home, were they not in the office?
Well, they would be talking on a
regular
phone set.
Right.
It's the speakerphone is essential
In the
at the office
okay.
where the two parties are conversing with the interpreter at home. And we've subsequently increased the capability in all our offices to utilize this system. In fact, all the worker stations at current date have speakerphones and have the capability to access the system.
Max?
Could you elaborate on the ability to continue to recruit volunteers who speak these 33 or so different languages? It seems to me that is a management problem, because you've got to know where they are and to identify them and get them plugged into the system.
Well, that's what when I said that it's maybe easy to, because it's a simple process, it may be easy to replicate it, but it takes a lot of commitment, because this is a very fluid group, constantly recruiting volunteers, but you can't just stop there. Some of them disappear, move on. We have to constantly recruit. This afternoon at lunch, Sonia was trying to recruit somebody from Hawaii to tell her who she could get who spoke a Polynesian language. I mean, it's a constant process. And we, not only does Sonia do this, but we expect our coordinators at each office to help her look in the community for resources. We look in various cultural groups. We use cultural associations in and out of different areas as resources. And they've been very willing to help us because they see it as a way for their community to get the services that they need.
Luis?
Has this program encouraged discussion in other areas of state government to use volunteers? Not necessarily as interpreters, but just the usage of volunteers? We have long before we had this project, we had volunteer coordinators at the regional, at the state level, and at each office working on the process to bring in volunteers. And we've always historically had volunteers doing various types of activities, from simple clerical tasks. We've had volunteers actually certified to do casework. So we've used volunteers up through the process where
we can recruit them and where it makes sense and where there's a payoff there. So we've been invested in the idea of volunteers long before this process started.
And our time is up. Thank you very much.